All right, so let's get started. So hi, everyone. Thanks for joining me tonight. My name is Dr. Catherine Chan. I'm actually one of the minimally invasive GYN surgeons at NYU Langone Health. So what does that even mean? It just means that I did additional training in the management of complex GYN conditions like fibroids, endometriosis, and minimally invasive surgery. And today we're going to be talking about endometriosis and what to expect before and after surgery. So luckily with us, we have Serena joining us tonight. And I first want to give her the opportunity to share her story about her endometriosis journey and what her pre-op and post-operative course looked like. And then we'll talk about what endometriosis is, some different treatment strategies, and then touch really on surgery and what to expect before and after surgery. So Serena, I'm gonna give it to you.
All right. Hi, I'm Serena. I am 26, and I guess I was officially diagnosed with endometriosis in October when I had a laparoscopy with Dr. Chan. I guess a bit of a backstory. I had painful periods, heavy periods, irregular as in off every 19, 20 days. I would get my period for most of my teenage years, and it was really painful, uncomfortable. I'd have to stay home from school, but I'd never heard of endometriosis or anything until I was, honestly, I think maybe in the past year. I really started to hear it as I got a new OBGYN who is at NYU and then who eventually referred me to Dr. Chan. I got surgery in October, and I started meeting with Dr. Chan. I had an ultrasound, I think a pelvic MRI, a colonoscopy, all as a build up to the surgery. And almost 2 months post-op, I'm feeling great. I'm trying to think what else might be relevant. So the surgery, it went well. And then should I get into like my experience post-op right now, or kind of wait till we talk about that?
We can wait until we talk about it.
Okay.
So we can go back and forth, and I'm happy to have you like jump in whenever you feel like, oh, hey, I definitely want to mention this here.
Yeah.
So let me share my
I guess.
screen. Yeah, go ahead.
I guess just in the pre-diagnosis, for years I had this pain, and it wasn't until I was in my 20s that I started to really realize that that wasn't normal, and that growing up as a teenager in this pain, like I kind of would tell myself, push through it. I was a dancer, and I was used to being in pain, and I would just try to push through it, and I tell myself to be strong. And I think that's a theme across the women who are suffering from this.
Thanks for sharing that. All right, let me share my screen. All right, can you guys all see my slides? I hope so. So we're going to be obviously talking about what to expect before and after surgery. Thank you, Serena, for sharing your story. Like I said before, we're going to be talking about like what is endometriosis, what are some treatment strategies, and then get into the nitty gritty of like what surgery means, what it looks like, what recovery will look like. So one of my GYN surgery colleagues actually said this to me, and I thought it really like resonated because honestly, it's true. In medical school, we're taught that endometriosis is kind of like a zebra when really it's a horse. And it's so common for women to have endometriosis. And it's something that we really should bring into the forefront of GYN care. So briefly, like what is endometriosis? So endometriosis itself is a condition in which a type of tissue that forms the inner lining of the uterus, the endometrium is actually found outside of the uterus. So like that is the endometrium, and you can find different endometriosis tissue outside of the uterus. It can be in the fallopian tubes, in the ovaries, in the appendix, on the colon, bowels, in the bladder. It can really be anywhere. That being said, it affects about 1 in 10 women. It's often diagnosed in women in their 30s or 40s, and about 4 in 10 women with infertility actually have endometriosis. So what does having endometriosis look like? So like Serena said, most common symptom of endometriosis is chronic pelvic pain, especially before or during the menstrual period. It can also occur with sexual intercourse, bowel movements, urination. And many women with endometriosis actually don't have any symptoms, but learn about it when they cannot get pregnant, they deal with infertility or are having surgery for other reasons. So what causes endometriosis? I mean, we have several theories as to why women have endometriosis. It's still very unclear. These endometriotic implants respond to changes in a hormone that is normally secreted by the ovaries, which is called estrogen. And these implants may grow and bleed just like the uterine lining every month and cause local inflammation and scarring. So briefly, just to go into some treatment options, we know that the mainstay of therapy for endometriosis is actually hormonally driven. So as a menstruating, reproductively aged female, you're going to continue to have increases and fluctuations in estrogen monthly. And so as long as that's the case and you're not in menopause, the endometriosis can recur and come back even after any type of surgical procedure. And so before surgery, we recommend a trial of hormonal medications, and after surgery, you may benefit from some hormonal medications. So if therapy is primarily hormonally driven, like why do we even do surgery for endometriosis? So patients will undergo surgery for unresolved pain. So some patients will have tried multiple medical therapies, multiple progesterone IUDs, combined hormonal contraceptive pills, other medications as well. They may have endometriosis cyst, or also called endometrioma. So that's endometriosis in the ovaries. They may suffer from infertility. You may have involvement of other organs like the colon, the bladder, and causing some of those symptoms of painful bowel movements or painful urination. So goals of surgery, really one would be to obviously confirm the diagnosis of endometriosis, but something that I tell all my patients is that you can have endometriosis all over the abdomen at the time of surgery and have no symptoms, or you can have no endometriosis at the time of surgery and have a billion symptoms. So the amount of disease that you may potentially have at the time of surgery does not necessarily correlate with how bad your symptoms are. And that's why a lot of women go undiagnosed. Another goal is obviously to remove as much endometriosis we see. So really when we're doing surgery, you're going under general anesthesia, and we want to really decrease the amount of time you're under anesthesia, but also decrease the number of times you're under anesthesia. And so the goal is to remove as much as we can in one sitting so that you're not going to the OR multiple times a year, every couple of years for the same reason. Another goal is to improve your pain and then to restore normal anatomy. So what can happen with endometriosis outside of the lining of the uterus, it can cause local inflammation and pain, but also cause a lot of scarring at that level. And so we want to restore normal anatomy so that things can function as they should. And then lastly, to treat infertility. So what types of surgeries are actually available? We can remove or burn endometriosis. That's called an excision or an ablation. We can do a cystectomy, which is removing an endometrioma. So on the right, you'll see that it's a pretty gnarly visualization of a cyst on the ovary. This is the cyst, and then you can see there's some old blood, which is very consistent with endometriosis and endometrioma. We commonly you may hear the terms like chocolate colored cysts or chocolate colored fluid, and that's just old blood. And then along here, this is the view from laparoscopy, you'll see that it's very close to the bowels. And then on the image on the left is just an ultrasound image of what an endometrioma would look like on ultrasound. And then other surgeries other than cystectomy is just removing endometriosis deep within the reproductive organs. So if you ever get an imaging study, it may read that you have deep infiltrating endometriosis. That means that it involves kind of deep spaces within the pelvis. So behind the uterus, in front of the uterus, close to the bowels, close to the bladder. And then lastly, sometimes women will have persistent pain that may require removal of the uterus, which is called a hysterectomy, with and without removal of the ovaries. So briefly touching upon minimally invasive GYN surgery. So it's a surgical approach where specialized tools are actually used to make small incisions, usually less than an inch on your abdomen. And then specialized tools are then inserted into these small incisions to perform surgery. Why is it beneficial? So it's associated with a quicker recovery. There's less pain. There's faster return to work, school, and pre-surgical functional status. Obviously, there's smaller, more cosmetic incisions and lower rates of complications. And most of our patients actually go home the day of surgery. So these are some things that I want to talk about prior to surgery. Serena, do you have anything to like add in terms of like pre-op stuff or what to expect prior to surgery? Or you want me to keep going?
I guess I would add that I had such a great experience working with you and the whole NYU Langone team. And I felt by the time I got to surgery, I felt really prepared. I think it's really helpful for patients that the NYU Langone shares all of your testing information, all of your test results, your clinical notes, and I felt like I just had access to my what my health plan and my surgical plan, and that felt really good. And I felt that I could contact you with questions and that they were answered pretty much right away, and it felt really good. So yeah,
I'm glad you
so
had
I
a
guess
good
that's what I'd
experience.
add so far. Yeah.
Yeah, yeah. So like what to expect prior to surgery. Obviously, your surgeon and their team is going to contact you with specific instructions, and every patient is clinically different. Every surgical plan is tailored to your pathology and what's going on and your clinical status. Um, Generally, patients may be required to obtain medical clearance, meaning like if you have some medical issues that should be addressed prior to surgery, that you go see your primary care doctor prior to that, or a hematologist if you need to. Some patients may be asked to go for pre-surgical testing, so that may include some lab work to be done prior to surgery, maybe to see the anesthesiologist. But then also after, before surgery, you'll get a call from the hospital just detailing like the time and where to go and like when to start fasting before your surgery. And this call usually occurs the afternoon prior to your day of surgery. Is that true for you, Serena?
Yeah, yeah, it
Cool.
was the day before. Yeah.
Awesome. And then preparing for surgery, like I said, each patient's instructions are going to vary, and then instructions generally vary by surgeon. But like in general, make sure you have someone to bring you home after surgery, just like a companion. Because you're undergoing general anesthesia, you may be pretty groggy afterwards, so it's nice to have someone close by. You may be asked to discontinue certain medications or fast prior to your surgery. You may be asked to prepare or cleanse your bowels prior to surgery, depending on how extensive we think your endometriosis is. And then, like I said before, you might be asked to come in for like a preoperative evaluation. So the actual day before surgery, you may be asked to shower with like a specific soap or wipe. We recommend that you don't apply any like lotions or creams and that you remove all jewelry. And then one thing I tell my patients is to just like rearrange commonly used items at home so they're like accessible and at waist level. Um, when you have surgery, like your body kind of takes a hit in terms of stress, and you don't realize how like deconditioned you are until you go home and you're like, oh, I can't do like my normal activities. So I generally try to have like patients get ready and get their home ready for that so that it's easier when they get home. I don't know, Sarita, what do you think?
Um,
Any like tips and
I
tricks?
totally agree. One thing I would definitely recommend is bringing a soft pillow that you could put across your abdomen in the car ride home. It's New York City, so it's probably going to be a taxi, Uber. Definitely not going to be on the subway. But just to buffer your abdomen and your pelvic area from the pressure of the seatbelt, that really helped me, and I can't imagine if I didn't have that. And for me, I'm not a medical professional, but so I don't want to recommend anything to everyone, but peppermint tea really
Ooh.
helped. It just kind of warmed me up, and it felt like it settled my stomach. And some sort of tea, I think I would recommend. Just I threw a couple bags in my big surgery tote bag, and I had some at the hospital.
Wait, that's so helpful. I'm gonna add that in.
Yeah, I read that peppermint tea is known to help with bloating as well. I didn't read the studies behind that, but it helped. It seemed to help me.
Um, Great. So then the actual day of surgery, so the morning of, obviously, like Serena said, you'll have like a hospital bag or like something like a tote to bring to the hospital. Things you want to bring are like your government issued ID, insurance card, any advance directives. You want to wear loose fitting, comfortable clothing so that like when after surgery, you're not like thinking about squeezing into like jeans or like leggings. Honestly, whatever is comfortable, whatever you would normally wear in the comfort of your own home is probably best. Um, like I said, leave your jewelry at home and bring a friend or a family member to take you home after the procedure. And then ideally try to arrive on time, although sometimes if you're like scheduled for very early, it is quite difficult to get to the hospital 2 hours before when you're scheduled for a 7:30 start, but we do appreciate it. And I promise you your surgeon is there as well. Anything else you think we should pack?
Um, I
Oh, other than
would.
the pillow?
Oh yeah, other than the pillow, you talked about the loose fitting, comfortable clothing. I'd really emphasize the loose fitting because you may be bloated and it may hurt to kind of, as you said, like fit into so that tighter clothing. So just anything with a drawstring, I think
Yeah.
would work. And the other thing I would add is if you're a contact wearer, I would leave the contacts at home and wear your glasses
Nice.
because you don't want to be dealing with the contacts while in the hospital.
And then immediately after your surgery, so same day, you will wake up in the recovery room. It's going to be a place that's completely foreign to you. It's normal to feel like completely groggy because your anesthesia may take a few hours to wear off. If you're undergoing minimally invasive surgery, which most of our patients do, you may notice that your face is a little swollen, and that's just based on like positioning during your surgery, but that will, I promise you, go down. And then during this time in the recovery area, our team will monitor you continuously. So like when will you be ready to go home after surgery? So there are certain milestones that we look for a safe discharge. Obviously, your pain is well controlled, you're able to walk, you're able to tolerate some sips and ice chips, and you're able to urinate. So I think I'm going to leave it to Serena to talk about this. But a common deviation is that you may not be able to urinate prior to discharge. And what happens is that your bladder may need more time to wake up from anesthesia. Even if we don't do any surgery on your bladder whatsoever, your bladder may just not be ready. So you may go home with a catheter to allow your bladder to rest. And generally, it'll be removed in the office where your surgeon will test if your bladder is ready. But Serena, you can go into this if you'd like.
Yeah, so that happened to me. I was unable to urinate upon waking up from surgery, and I was in the hospital for some hours, I think, because of that. They gave me some extra time and a window to urinate, or I guess a deadline to urinate by with before they would just put the Foley catheter in. Um, so I was in the hospital. They gave me IV liquids. I tried a few times with a nurse who was so sweet and kind, would help me to the bathroom, and I would sit on the toilet and try to urinate. And just nothing would come out. So then eventually, at the hospital, they did use a catheter. I went through that process a couple of times, and then I ended up going home with a catheter. Everyone was really nice and helped explain what to do with the catheter bag. I learned how to use it. I will say having the catheter is not fun. It was really uncomfortable. It hurt. When I would move around, I was already having the expected post-op pain and just bloating, and was uncomfortable, but there was this added pain. I'll say pain. Yeah, it was painful, and just severe discomfort of having this catheter in there. But I went home that night, and I was told to come to your office the following day to have the catheter hopefully removed, but to first at your office pass the
Yeah.
urine test, I guess, to urinate. So I ended up going to your office, and unfortunately, I was not able to pass to urinate on my own. So I went home with the catheter again, and then I was going to. That was a Friday, and it was a long weekend, and the plan was to come back to your office on Tuesday. And then I ended up, this probably would not happen to most people who go home with a catheter, but I sometimes seem to have weird luck. So it suddenly, like, my catheter, wasn't draining,
Yeah.
and I ended up going to the hospital and having them check it out, and they took it out and asked if I wanted to try to pee while there. I did, and I passed. I peed a lot, and never had a catheter since. But yes, it was an experience, not a pleasant one, but it once I did pee, it was probably the best feeling that I had. So I don't know. If anyone has specific questions, I'd be happy to answer them, but I don't really know, I guess, what would be useful.
Yeah, no, I think that was very helpful.
Yeah.
Certainly, like the catheter, like just for everyone's sake, the catheter goes in through the urethra, which is the opening of where your urine would drain, and it hangs out in the bladder. So whenever there's a foreign body within kind of the urethra, it can cause a lot of like bladder spasm and a lot of discomfort. So even if we like give you medications for bladder spasm, it may not help too much, as you can remember, Serena. But once we know that this happens um, with general anesthesia, we know that like next time, if anyone were to need surgery again, that probably they would just, we would monitor for longer, or we would use a smaller catheter, or even have you go home with the catheter with a plan to like have it removed in the office in a few days, as opposed to like, trialing, having you try to pee immediately afterwards. So common deviation, but honestly, really uncomfortable, and can happen.
Yeah. I will say that um I felt Dr. Chan really reassured me that I would eventually pee. It did feel at times like I will I ever pee again?
Yeah.
Will I have to wear this catheter? But I really felt like Dr. Chan made me feel more comfortable, and reassured me that this is a common deviation. It happens, and it's very temporary, which was yeah, a relief, I guess.
So then healing at home, generally recovery from GYN surgery may take 2 to 4 weeks. Depends on everyone's pain is pretty subjective, but we obviously want to be able to optimize your recovery. It's totally normal to experience some drainage from your incisions and some vaginal discharge. You may experience some shoulder pain. some gas pain or abdominal pain for at least 72 hours after surgery. A warm shower, heat packs, and walking will definitely help, and peppermint tea. But these are all like common things to feel after surgery. And then pain management. So your surgical team is really going to try to work with you to develop a plan that help you manage your pain before you are discharged from the hospital. Generally, generally your medications will be sent for you prior to discharge. You'll have clear instructions on how to take them. And then managing your pain, you may be told to take a combination of pain medications, including like Tylenol, which is acetaminophen, or nonsteroidal anti-inflammatories like ibuprofen or naproxen. If you have any allergies, let your surgical provider know. Be sure to take them as directed. But you may also be prescribed narcotics for breakthrough pain, and some patients really need it, and it's okay because you just had surgery. It's okay to take narcotics. It can make you a little bit sleepy and make you a little bit constipated. So we recommend that you take a stool softener to help with bowel movements. You're not expected to have a bowel movement for literally 3 days after surgery, so it's totally normal. And then caring for your surgical sites. If you have any bandages, you can remove them about 48 hours after surgery. If you have like little tapes over the incisions, you can remove them about 7 days. Showering is absolutely fine after surgery. The only thing we ask is that you don't scrub your incisions, you keep the areas dry, no oils, powders, or lotions in your incisions until you see your surgeon in the office. And then they'll discuss with you kind of like scar prevention, or if you wanted to use any silicone strips to prevent like keloiding or scar formation. And then generally activity is recommended. Just no heavy lifting, usually like greater than 10 to 20 pounds for about 2 to 6 weeks. I like to say 2 to 6 weeks, depending on how extensive the surgery is. Nothing in the vagina. We say don't operate any heavy machinery if you're taking any narcotics for pain relief, just because it can make you pretty groggy. And just to recap, like your recovery is going to range. You might have some pain, some swelling, some bleeding. For some patients, that's um, more intense than others. It really depends on how long your surgery is, how extensive your surgery is. Um, and then take your medications as instructed. We obviously want to try to limit any opioids to severe pain, but obviously you did undergo surgery, so you may need them. Keep your incisions dry, clean, wash your hands often, just general hygiene, and then contact your care team if you have any questions regarding your surgery and recovery. Like Serena said, we are very accessible, especially with the MyChart app. You can see like your surgical care, your operative reports, your imaging studies. So any questions you may have, it's definitely message your surgeon or your surgical team. Um, so I'm going to open up the floor to any questions, but thanks for listening. So a question, are there any causes to endometriosis? So generally when we think about endometriosis, there are three main theories as to why we think it happens. So one of them is something called retrograde menstruation. So when you're menstruating, that endometrium is supposed to bleed and all the blood comes out the cervix and out the vagina. Sometimes, if you notice in the diagram from before, some of the blood goes through the fallopian tubes and back into the pelvis. And so that can cause endometriosis to occur. There are some theories looking at spread of endometriosis through the blood or lymphatics. And then another theory is that endometriosis kind of just develops in rapidly reproducing cells. So those are kind of like the main three theories that we think about, just because like we've oftentimes found endometriosis in areas that have nothing to do with where your flow would be going. So like in the lungs or in the liver and in the spleen. And so when we find it there, we think about, maybe it's spreading by the blood, from the lymphatic flow, or it's just happening locally. I think, Serena, this is a question for you. See,
Oh, I can't see it, so.
oh, Serena, if you don't mind sharing, how did you find out that you had endometriosis?
Yeah. So as I said earlier, I had what I now know to be some of the very classic symptoms of endometriosis for years. And pain was the worst symptom, but I had the heavy bleeding. And as a teenager, late in my teen years, I got an IUD for a hormonal IUD for to try to help with some of these symptoms, help with the bleeding, and that it did help. It helped. I wasn't getting my period, and it did help with the pain and everything for a while. And then my symptoms started coming back, and I got a new IUD to try to see if that would help. And it did for a bit, and the same thing. So I was talking to my OBGYN about these symptoms, or actually I got a new OBGYN, and I was telling her about it, and she was the person who first mentioned endometriosis, and she kind of put it on my radar and said, we'll try this new IUD, and then I'll check in a few months and we'll go from there. And I I was still having a lot of pain. It was eventually started to get worse and worse. And even though I wasn't getting my period because of the IUD, I was getting all of the pain. I would throw up sometimes. Like I would have to call out of work. Like I was just in pain with intercourse. Like just everything was so painful, especially when I guess it would have been my period. And so once I was talking to my doctor about endometriosis, she kind of explained what it is, and it seemed to really fit. I'm not someone who likes to immediately hear about something and check off my symptoms and say that's what I have, but it really did seem worth pursuing specialized help. So my OBGYN referred me to the endometriosis surgeon surgical team, I guess. And then I got an appointment with Dr. Chan, and I could not have asked for a better doctor. It was,
You're so sweet.
I had such a good experience, and it was, other than my OBGYN who had initiated this, like it was the first time I really felt like a medical specialist was sitting there kind of telling me, validating my symptoms, but also saying like, this is something that, yeah, it exists, and it affects many women, and I think it's worth pursuing to kind of, I guess, do the laparoscopy first to help with pain, and also to get that diagnosis. So I guess long answer to the question, I found out officially through the diagnostic laparoscopy, in which they was also took out whatever was found, endometrial tissue. But it was really through my OBGYN kind of thinking that this might be the root cause of my pain, and then pursuing specialized care.
Thank you.
Yeah.
So another question, how do you diagnose a patient with endometriosis? Great question. So honestly, it's sometimes just based on symptoms. Like we often say kind of in our community of GYN surgeons and OBGYNs in general that endometriosis is diagnosed surgically. So obviously through excision or biopsies, but we see a lot of women with pelvic pain, and it's very, very common. And so in working with that theory, and knowing that 1 in 10 women are affected by endometriosis, it's very, very common. And so we can kind of use it as a working diagnosis until until a patient has trialed medications. And really, we like to try some hormonal management first and see if the if your body responds, because you will, if it is truly endometriosis, you will get some relief from hormonal management. Certainly, there are many, many, many different causes of like pelvic pain, including like things with the intestines, like IBS or inflammatory bowel disease. There can be issues with the bladder, like if like bladder pain syndrome or any issues with the pelvic floor. So if you have a tight pelvic floor, sometimes that can present as chronic pelvic pain. So really taking that first visit and seeing a specialist and taking the time to explain your symptoms, and going through and keeping like a bladder, like a menstrual diary is sometimes helpful, and just determining what the pain could be from. Um, are there any lifestyle changes that can help with endometriosis? So certainly there are some specific, we are actually looking at certain dietary changes and lifestyle changes that can be helpful for endometriosis. We know that endometriosis is activated by estrogen, so anything that can increase your estrogen levels, like obesity, can affect your symptoms. So certainly maintaining kind of a healthy lifestyle and making sure that you're following up with normal preventative health care, seeing a primary care doctor, gynecologist regularly, is something that we recommend to all of our patients. Any other questions? I'm going to take this opportunity to like put a plug in for our NYU Endometriosis Center. So it's a great way to learn more about endometriosis. We have all of our webinars are actually recorded and placed up on the YouTube for the Endometriosis Center. We also have a center for fibroid care and management of fibroids. We also have webinars for that as well. And so you're at that point, like go on the NYU Langone website. I know Serena said it was really helpful in preparing for surgery, but all of our webinars are up there in perpetuity.
Yeah, if I can jump in.
Yeah.
I when Dr. Chan asked if I was interested in participating, I was hesitant at first because I am pretty shy. I don't really like to do things like this, but I remembered how much these webinars, specifically through the NYU Endometriosis Center's YouTube, because these are all uh, uh, uploaded to YouTube. That's the word. And there's so much information there, and it really does help to hear from the different specialists at the center and patient experiences. And when I decided to pursue surgery, I also was learned a lot of what to expect, and it was super helpful. So I think they're a great resource. And yeah, it's the my whole experience, like I keep saying, was just so great at NYU. And I think it's because part of it is that they're really focused on patient education and making sure that you feel and are a part of your care team yourself, and can really advocate for yourself and say, this is, I want this, I don't want this, and what do you think? And just really be a part of that. Be a decider in your own kind of medical journey.
Any other questions? Feel free to reach out to us about what you want to hear more um, on endometriosis, anything that we can answer for you. We'd love to do a webinar on it. Serena, I'd love to hear, your thoughts on like what future webinars we should be having and like what topics would be so interesting from like a patient perspective. So let me know if you think of anything. Um, Kiara, if we don't have any other questions, I think we're done for tonight. What do you think?
Agreed. You guys did a great job.
Oh my gosh, thank you. Thank you, Serena, for joining us. I do
Thank,
truly appreciate you being here with us tonight.
well, thank you for having me, and thank you again for just a wonderful, the best, I think, surgery experience I could have had.
You're so
Um,
sweet.
yeah, and I guess one thing I would add quickly is that,
Yeah,
like, even, even though I had the catheter situation that I spoke about, I feel like for me it was the right decision to have surgery, and it was really worth it.
yeah,
So if anyone is, it can be really scary. I have had unrelated surgeries in the past, so I wasn't too nervous, but I remember having my another surgery the first time going under anesthesia. Like it can be really like it can be nerve wracking, and I really felt like I was in the best hands, and I felt comfortable. And yeah, I think if someone is nervous, like these webinars are a great resource, and you can always, I think, tell your doctors, like I feel like I could have talked to Dr. Chan, and if I was feeling nervous, and she would have really helped me through that. So it was definitely worth it for me, and that's all, I guess, all I wanted to add.
well, thank you so much. I'm glad you had a good experience. That's all we're really here for, is to make sure like you feel involved in your care. Like you said, it's a collaborative effort. Like obviously it's your body. You have to know what's going on, and it's our jobs to make sure that you know exactly what's going on, um, and what the next steps are. All right. Well, thank you everyone for taking the time to join us tonight. Um, Feel free to reach out if you have any questions. Thank you, Kiara, for setting this up, and have a good night.